Right now at 5:30, a new warning from the FDA about a rare and deadly cancer that's been linked to certain breast implants. This comes after 9 investigates told you some women were having them removed over other health concerns.
My body was breaking down. I mean, I could not do anything.
Tonight, we'll show you how doctors are learning how to spot symptoms of the disease early. Breast implants are the most popular plastic surgery procedure in the country, but now the FDA is warning about more cases of cancers and more reports of deaths.
This is alarming. Investigative reporter Darlene Jones first introduced us to a group of women in 2017 who said they feared the implants made them sick. Darlene joins us live in studio tonight. Darlene, for the first time, the FDA is now sending letters out to doctors.
This is a big deal, Greg. 300,000 implant surgeries are performed each year throughout the U.S., and that's why the FDA is making this unprecedented move, and it's exactly what local women have been pushing for. More education. The FDA targeting primary care physicians, gynecologists, urging them to learn the symptoms of this rare form of cancer so they can better diagnose women who may be at risk. This is the letter the FDA is sending to a long list of medical providers from radiology, internal medicine, gynecology, and even emergency rooms. It's a major win for women like Terry Diaz of Orlando, who we first introduced you to in the summer of 2017.
It's just so important for the awareness so that there are not, like me, I was home, had no clue, and I was just dying, and no doctor could figure out what was wrong with me.
Her symptoms did not improve, she says, until the $6,000 breast implants were removed. Today, she's still recovering.
I still have food issues, food intolerances. I still have some fatigue.
The FDA alerted 9 investigates overnight through this email that new information shows more women have been diagnosed with the rare type of deadly lymphoma. 457 cases now, up from 414, but that's only up until September of last year. 9 deaths reported in the U.S. alone.
To be clear, the number should be 0, but the overall risk for a woman on the high side, we're talking about 1 in about 3,800.
None of the women we spoke with have been diagnosed with lymphoma, but the news is still significant for them because a majority of the lymphoma cases have been linked to those textured breast implants used for cosmetic and reconstructive surgeries. The same implants some women told us caused illnesses that only got better when their implants were finally removed.
I would be close to death. My body was breaking down.
Now, Darlene, it's important for women to keep in mind that this is a medical device that you are putting into your body.
Exactly. Ask questions about the product. Read the warnings before you do this surgery. It's all there in the paperwork. We told you last month the FDA is scheduling a meeting for next month with women to discuss changing the so-called benefit risk paperwork associated with these breast implant profiles to determine if more information should be added. Local women will be in that meeting. Of course, we'll keep you posted on all of that.
So many times those forms and those warnings are so long, but it's important to sit and read.
Yeah, and you know, women tell me they feel like doctors actually rush them through that paperwork because remember, most women get this surgery and it's a lot of money.
Yep, and they'll take your credit card.
Yep.
All right, thank you, Darlene.